First of all, are the cranial nerves part of the CNS or PNS? How many say CNS? How many say PNS? Well, the rest of you don't are scared to answer or what? Think about it. I'll give you 10 seconds to think about it. They're called cranial nerves. So the CNS is made up of, but what are the parts that make up the CNS? Brain and spinal cord. And the PNS, so name some things in the PNS. No, those are not part of the nervous system. Muscles and glands. Muscles are part of the muscular system. Nerves. Come on, y'all. Nerves. Nerves and ganglia. Okay, so one more time. Are cranial nerves part of the CNS or PNS? Yeah, still off. They're nerves. Okay, the word nerves give it away. So when you looked at the picture, the nerves are, what about the other nerves? So the spinal nerves are nerves that come off of the what? Spinal cord. The spinal cord is CNS, but the nerves are PNS. So you have the brain, which is CNS, but it has nerves coming off of it. The brain is CNS, the nerves coming off are PNS. Okay? So, cranial nerves are part of the PNS, peripheral nervous system. So they allow the brain, just like the spinal nerves, to communicate with the muscles and glands and receptors to send signals to the brain. Okay? So the cranial nerves allow communication with the rest of the body. So we'll see that some of the cranial nerves have motor function, which means the signals start in the CNS and go out to an effector. And then others have sensory function, which means signals come into the CNS by way of those cranial nerves. Once you all know the functions, which you're going to have to know, you'll be able to tell on the test whether the cranial nerve has sensory function or motor function. For example, the olfactory nerve is the first one. Olfactory nerve has to do with a sense of smell. So would that be a motor or a sensory nerve? Sensory. Okay, so anything motor has to do with what? Some type of movement, okay, or stimulation of a gland to secrete. All right, so let's look at the specific nerves and make sure you all have an idea of the function. So the olfactory nerve, as you all just told me, is what provides our sense of smell. So the way I would like for you all to think about it is not just memorize those, kind of think about it. So if we say the olfactory nerve, and you all remember the picture of it where it's located, the olfactory nerve provides our sense of smell. So in order for us to smell, there's a few things that have to happen. First, you have to activate a what? Receptor. Okay, so anything that happens in the nervous system, first there has to be a receptor activated. And those receptors, we'll see next week, are in the nasal cavity. And once they're activated, those receptors send a signal to the correct part of the brain by way of the olfactory nerve. So the olfactory nerve just transports the signal from the receptor to the correct part of the brain. So that's kind of how you should be thinking of all these cranial nerves. There's a receptor that is activated, transmits the signal to a particular part of the brain. That is, if it's a sensory nerve. If it's a motor nerve, the signal starts somewhere in the brain, goes out through the cranial nerve, and stimulates a muscle. Okay? So try to visualize the pathway as much as possible. Okay, the optic nerve. So the optic nerve provides vision. So what is the organ that provides vision? The eyes. Okay, so our eyes are the organs for vision, And so there must be receptors in the eye. We'll talk about that next week too. So the retina, you all remember where the retina is? Where's the retina in that picture? What did it look like in the picture? What color was it in the picture? You all remember?
Right.
Yellow. Right, so it's the back part of the eye. So that's the retina, and that's where our receptors for vision are, called photoreceptors. You all may remember hearing about rods and cones. Those are the photoreceptors. And once they're activated, they transmit a signal to what part of the brain? What part of the brain? Good. Okay. Good. So there you go. So you activate the receptors, and they send a signal by way of the optic nerve back to the occipital lobe. So if there's something wrong in any part of that path and the signal can't get to the occipital lobe, then there's no vision. You can't see. Okay? And then we have the oculomotor. Oculo means what? Pertains to the eye. Right. So oculomotor, motor meaning movement. So the oculomotor nerve provides eye movement. So what this nerve innervates are the muscles called the extrinsic eye muscles on the outside of the eye. And there may be, I don't know, these slides, I don't know if they have a picture of it. But next week I'll show you a picture of the muscles around the eye. We have 4 rectus muscles, superior, lateral, inferior, and medial rectus muscles. And when they contract, they move the eye either way. So if the lateral rectus muscle is stimulated, the eye moves that way. If the medial rectus is stimulated, it moves that way. So these are muscles that are innervated by the oculomotor nerve. So if you compare cranial nerves 1, 2, and 3, which would you say are sensory nerves? Which would you say are motor? Good. So 1 and 2 are sensory, 3 is motor. And let's go down to the trochlear nerve. The trochlear nerve also controls eye movement. It just stimulates a different muscle than the oculomotor nerve stimulates. There's 4 rectus muscles I told you about. The trochlear nerve innervates one of the oblique muscles called the superior oblique. I'm not going to ask you all to know which specific muscles are innervated. Excuse me. Just make sure you know that both of those involve movement of the eyeball. And then you have the trigeminal nerve, and this one may pertain to the labs you all are assigned for today. And the trigeminal nerve provides facial sensation. And what that means is, if you're touched on your face, the reason that you recognize that is because of this nerve transmitting the signal to the brain. What part of the brain? What part of the brain would you say facial sensation signals travel to? Sensory. What's the primary sensory? One of the gyri. Remember the precentral gyrus and postcentral gyrus? Which would you say? So which one is primary sensory? Postcentral. So then the trochlear nerve, the trigeminal nerve would transmit a signal from the face, the receptors on the face, to the postcentral gyrus for us to realize sensation. And what makes this one interesting is there are sometimes problems with this nerve. And there's a condition called trigeminal neuralgia. You may also see it called tic douloureux. And what happens in that condition is, for some reason, this nerve gets inflamed, and the individual feels like they're being repeatedly stabbed some part of their face, even the eye. Okay, so it provides sensation to the face, but also to the eye. And so it could feel like somebody's being stabbed in the eye repeatedly. And there's nothing wrong, but the nerve is inflamed. And sometimes it can be so debilitating that the individual just opts to have the trigeminal nerve cut. So there's no pain signals going to the brain anymore. And the concern with that, though, is that they'll lose what? So if your trigeminal nerve is cut, what effect would that have? You wouldn't be able to feel anything on your face. Mm-hmm. There you go.
That include like the lips too?
Mm-hmm. So that would cause you to have numbness pretty much on your face and your eye. So dirt could get in your eye and you wouldn't feel it. Okay?
Does it subside?
Sometimes, but then sometimes it's so severe that people just can't do anything.
So, they have to do like eye twitching, or does it go back to the throat?
No, this wouldn't, because it doesn't have anything to do with the muscle. The twitching is stimulation of muscles. Okay, so that's the trigeminal. And then we have the abducens. So we have 3 nerves here involving eye muscle movement. And again, the difference is they're stimulating different muscles of the eye, moving the eye in different directions. You all remember in joint movements there was abduction and adduction? Which one is abduction? Away, moving away from the midline. So the abducens nerve is named for what it does. It stimulates the lateral rectus muscle. So when the abducens nerve stimulates the lateral rectus, it causes the eye to go outward. Okay, sort of like cockeyed. So that would be abduction of the eye, because it's moving the eye outward. Adduction of the eye would be like what? Being cross-eyed. So that's the abducens. That would be the oculomotor. Mm-hmm. So the oculomotor, you'll see, innervates most of those muscles. The trochlear innervates one. There's actually 6 of them, 6 extrinsic muscles of the eye. The abducens stimulates one, and the trochlear stimulates one. The oculomotor has the others. Okay. And then the facial nerve, the other one that you'll have to discuss on the lab. This one is more involved in facial movement, movements of facial expression. And let me go back for 1 second. So when you think of facial movement, think of the facial nerve. When you think of facial sensation, think of the trigeminal nerve. But they're somewhat mixed, because the trigeminal nerve also stimulates the muscles for chewing, the muscles of mastication, you may hear. But it's mainly a sensory nerve. The facial nerve has primarily the movements of the face, such as the movements in smiling, facial expressions. And also, it's sensory because it provides sense of taste. Okay? And it also allows the production of saliva, stimulates the salivary glands and the lacrimal glands to secrete tears.
Is there pain sensation?
Hmm?
Is there pain sensation with the facial nerve?
No, it's not that. No, it's not that type of sensation. The reason I brought that up, though, is because sometimes you'll see that some cranial nerves are classified as sensory, some as motor, and some are mixed. So this would be mixed because it does have sensation, but it's not touch sensation, it's taste. The sensation is taste here.
So if those palsy is not painful?
No.
It's not painful.
Good. You all have that on the lab today. Okay. So vestibulocochlear, and that one you all should have studied for the lab you just took, the lab exam. Notice there's a vestibular nerve and a cochlear nerve. And what they do is merge to form the vestibulocochlear nerve. Okay, so they provide our sense of hearing and equilibrium. So next week we'll go over the functions of the internal ear, and you'll see that the cochlea is the organ of hearing. It has the receptors for hearing, whereas the vestibule, the vestibular apparatus, has the receptors for equilibrium. And we'll go into that next week. Then we have the glossopharyngeal. Glosso, you see that in 9 and 12. The glosso means what? Glossus has to do with the tongue. Good. So glossopharyngeal, what is the pharyngeal? The pharynx, the throat. So you should be thinking tongue and throat when you see the glossopharyngeal nerve. So it provides tongue and throat movement and swallowing, as well as saliva secretion. And then you have the vagus nerve, and the vagus nerve regulates most of the viscera. And by viscera, what do we mean? What are the viscera? Good. The organs, the internal organs, the heart, the lungs, the intestines. So the vagus nerve regulates the activity of the internal organs. For example, the heart rate, things like that, the diameter of the bronchi, all those we'll get into next week. And also, you'll see that the vagus nerve, since it regulates the viscera, it can be fatal if both of the vagus nerves are cut. So keep in mind we have 2 of each of these cranial nerves. The accessory nerve provides swallowing, head, neck, and shoulder movement. And then the hypoglossal, what does that word mean? Hypoglossal. Below the tongue. Okay? So it's below the tongue, and it also provides movement of the tongue. Okay? So you see 2 nerves then that provide tongue movement. Again, the difference just has to do with which part of the tongue is innervated and which way the tongue will move. So I'm not going to expect you all to know all this, but if the glossopharyngeal nerve is cut, for example, the tongue will deviate in one direction. If the hypoglossal is cut, it will deviate in the other direction. So they're just sort of complementary. All right, and these 2 disorders are what you all will have your assignment on today. The trigeminal neuralgia, that's also called tic douloureux. And usually I use that word on the test. I don't say trigeminal neuralgia because if I ask you which nerve is involved there, the name is there, the trigeminal. So I use tic douloureux instead. And again, that's recurring episodes of intense stabbing pain in the trigeminal nerve area near the mouth or nose. Pain is triggered by touch, drinking, washing face. Treatment may require cutting the nerve. And then Bell's palsy is degenerative disorder of the facial nerve, which causes paralysis of facial muscles on one side. And in some instances, just imagine if you wake up one morning and one side of your face is not moving. A lot of us would be worried, okay, did I just have a stroke? You know, because you have almost the same effect there. But Bell's palsy is usually you recover from it in a few weeks, 3 to 5 weeks.
Have you ever heard of it being accompanied by a rash? I had a friend who's like 17 who woke up with it just not too long ago, and she had a rash on the same side of her face. But it went away in a few weeks.
Okay. So she did have Bell's palsy?
They did finally. They took her a lot of places and they couldn't figure out what it was. And her mom researched it and went to the doctor and just asked. And they were like, oh, yeah, that's what it is. Okay. But I think the rash had thrown them off, but they're like, it must just be accompanying it, but it is Bell's palsy.
Interesting. All right. That's all I have for today. So on Monday,